Hi, I'm Dr. Shannon Dunley. I'm a cardiologist and assistant professor of medicine and healthcare policy of research at Mayo Clinic. And the title of the article is Contemporary Strategies in the Diagnosis and Management of Heart Failure, and it's scheduled to be published in the Mayo Clinic Proceedings. Well, this article provides an update on contemporary strategies in the diagnosis and management of heart failure by stage, A to D, that have emerged in the last several years, with a focus on review of most recent guidelines and clinical updates that may be most valuable to clinicians. Just to go by stage and give you an idea about the content of the article, Stage A includes patients who are at risk for heart failure because of the presence of comorbidities, such as coronary disease, hypertension, or diabetes. This includes a large portion of the U.S. adult population, and the major goals in this population are to be able to identify them. So we've included some review on ways of identifying patients who are at risk for heart failure, and also to control their risk factors to prevent them from progressing to developing clinical signs and symptoms of heart failure. Stage B heart failure includes patients who have cardiac structural abnormalities but have not developed clinical signs and symptoms of heart failure. And similar to Stage A, this includes a large proportion of patients. It's about 3 times as many patients who have Stage B heart failure as have Stage C heart failure, which we'll talk about next. And these patients, in addition to having risk factor modification, may also be eligible for evidence-based therapies, such as beta blockers, ACE inhibitors, and ICDs. Stage C heart failure includes patients who have developed the clinical signs and symptoms of heart failure. And these type of patients are the ones that we think of in our clinical practice, patients who are coming in to see us with heart failure. This article reviews the huge amount of research that has been done into how to best care for these patients over the last several years. In particular, we review trials that have investigated efficacious therapies for heart failure with preserved ejection fraction, comparative effectiveness research that has investigated how to best decongest patients in the hospital presenting with acute decompensated heart failure, and also it reviews the focus on 30-day readmissions, which is a major public health problem for patients with heart failure. 1 in 4 patients who are discharged from the hospital after a heart failure admission are readmitted within 30 days, and this article reviews the most recent evidence on how to perhaps prevent some of those readmissions. And finally, Stage D heart failure includes patients who have end-stage heart failure that's been refractory to common medical therapies for heart failure. And this can be a challenging patient population to care for, but perhaps the most exciting advances over the last decade are in how to care for patients, our ability to care for and manage patients with Stage D heart failure because of the advances in mechanical circulatory support. Left ventricular assist devices are now available that can be used in patients, implanted in patients with Stage D heart failure. It can help them to live longer and also to improve their quality of life. And they're not just available for patients who may need them as a bridge to heart transplantation, but they're also available for patients as destination therapy. And destination therapy, LVAD implants are implanted in patients for the rest of their life, and these can be used in patients who may not be candidates for heart transplantation due to age or excessive comorbidity. It can sometimes be challenging for clinicians to be able to identify when it's appropriate to refer patients to an advanced heart failure provider for consideration of LVAD and transplant. And we've helped to provide some guidelines in this article about when it's appropriate to refer patients to an advanced heart failure provider. Well, our goal in writing this article was to provide an update on the contemporary diagnosis and management of heart failure that would be most useful for clinicians in everyday practice. And we hope we've done this. There's been a lot of emerging research over the last several years, but we tried to really focus our efforts so that it would provide a thorough, concise review for clinicians who just want to know what has changed the last few years and how they can best manage their patients with heart failure.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.com. This video content is copyrighted by Mayo Foundation for Medical Education and Research.